My guests today are Dr. Izchak Barzilay, prosthodontist at Prosthodontics Associate, Dr. Courtney David, and Dr. Elahe Behrooz. They are here to speak to us about their trip to Uganda and the Ugandan Bridge to Health program in collaboration with the University of Toronto. I welcome you all to our Oasis conversation and thank you for making time to speak with us today.
Thank you very much for having us.
Thank you.
So I understand you have a presentation you would like to show us. So if we can go ahead and do that.
So this is part of our dental team that we had the privilege to work with. I'd have to say that our team was amazing. Everyone worked together very well. If you needed a hand for something, people were more than willing to give it. In this photo, we have Dr. Schwartz's side on the left there, Dr. Elahe, Dr. Barzilay. We have one of the local dental officers to our right. And then we also have Terry, and there's Ella and I, and Cheryl. So these pictures just show, it was actually wonderful when we first arrived to the complex or the apartments that we were staying in. We were greeted by one of their traditional song and dance. And that was really special. It went on for a few minutes, and then this was our view essentially every day. It was beautiful. We could see right into the downtown aspect of where we were staying.
Yeah, it was our first time going to Uganda for Courtney and I, and it was a gorgeous, gorgeous country. And we were told that it's typically mostly visited for bird watching and gorilla trekking. We just put the slide here to let you know that this wasn't what we ended up doing, obviously. So yeah, this is the team. This is mostly the dental team, and this is us arriving at the airport. So it was quite a travel.
Took us 14 hours to Addis Ababa, and then another 6 hours in total until we got to Rwanda, and then another 3-hour drive.
Yeah.
Wow, quite the long trip.
Yes, it was.
But when you're in a very good team, when you're with when you feel safe in the environment that you're in, it doesn't really seem that long. It just shows you how we had to take all our supplies with us. And one of these slides here shows that, we each had one bag of personal supplies, but then we had duffel bags filled with dental supplies that we had to take. So, it only could work through the collaboration with that and the cooperation that the team had together. And this is again what Courtney was talking about, how we were greeted when we got there. Very heartwarming, really something that I don't think any of us would ever forget.
It's actually the people that welcomed us into their homes. We still have on Facebook as friends. Like I've just recently, the dental officer that was in the first opening slide, Tino, he had just messaged me a few days ago. So it's really nice that we still stay in touch with these people and make new friends and keep them as well. So before we had left, so we went in February, and we had just been preparing for our dental boards, the NDEBs. So Ella and I, in the bottom slide there, are studying. And it worked out great, yeah. It was a little nerve-wracking going during that time, just we didn't know if we'd have time to prepare for the boards, but we made sure to also work hard but play hard as well.
Okay, so typically a typical day would be a 30 to 90-minute journey to different villages. Every day we would go to a different village. And the key for us was to be working very, very efficiently, basically. So typically in outreach programs or dental outreach projects, the focus is on infection control, pain management, mostly extractions, antibiotics are given, or pain medications basically prescribed to help patients with infection, pain. Prosthodontic rehabilitative treatments are typically not at the top of the list just because of the limited resources and time management issues. So this time, basically, we could do the stuff that we were supposed to do, which was infection control, focusing on extraction of hopeless teeth, and even teeth which would possibly have a hopeless prognosis in the near future, because we had to keep in mind that these were patients that would not get to see a dentist probably for a very, very, very long time. We also did a whole lot of fillings, hygiene, But our main accomplishment, I guess, was the prosthodontic treatments that we got to do this time. And so that's what we were very, very, very excited about. This just shows how people would gather up to see us when we went to different villages to treat them. And we only had that one day to spend with them. And it was really very, very heartwarming to see them gather and come greet us.
So how long would your days be? Work days be?
So our days would start at 8 o'clock after breakfast, and we would travel from where we stay to the villages, set up our equipment, start work at about 10:15 or 10:30, and then work till about 4:30, pack up, and then go home. We'd have to be out before sundown because we really didn't want to be on the roads late at night.
Wow, that's quite a long days. But well, I'm guessing you enjoyed yourselves, so.
Well, Advil became our good friend, and we managed to keep ourselves going with pharmacology.
Yeah, it's also, like as you could see in that picture behind, there is patients that would be lined up to have procedures done. Mm-hmm. And unfortunately, we wouldn't be able to make it through the entire line each day. So it was actually pretty special and neat was that the patients at the end of the line who were to be the next person to have the treatment done would follow us and walk to different villages to receive that type of care, whatever they needed to have done, extraction, a denture. Dentures were very high in demand just because it's something that was a new.
So yes, we would typically set up in a classroom. We did have days that we would set up in a church or any, because typically the medical team would set up outdoors. And we, as the dental team, we had the privilege of having, we kind of got to choose the indoor environment. Yeah, we would typically set up in a classroom or a church. And this slide just shows one of the missions that we had. It's actually a very important objective of the Bridge to Health, Medical and Dental, and they're very, very proud of this, that they're educating and training the local dental officers. So I have to say, as Courtney mentioned, they're very, very friendly, they're very nice, and most importantly, they're very eager to learn about how things can be done in different ways or with new techniques, new materials. They're very open to learning and to injecting the learning into their own practices. So it was really a pleasure to get to know them and get to teach them what we could teach them. And I have to say, we also learned from them. So this was definitely a very, very exciting part of the journey for us.
And really what you're looking at here is Cheryl, one of our assistants, applying fluoride to some of the school children. One of our missions was to apply fluoride to all the kids that were available to us. And we also left doses of fluoride for the local people to apply while we were gone. So this was the preventive concept was a big part of what we did. And again, we worked as a team putting together the equipment and the supplies, which is what you see here. And you also see Courtney and you see Ella working on two patients and making them some dentures, which really had never been done before in the way that we did it. The denture concept would normally work if you go into a village and stay there all week. We came up with methods of making dentures in the one day, delivering them, and then moving off to another location for more patients the next. And this was really quite innovative. We had support from many dental companies. We had the support from the International Outreach Program of the Academy of Prosthodontics. And most of all, we had the support of the Dean of the Dental School. We had the support of Dean Haas. He had the foresight, he had the sense to allow us to take two wonderful dental students and watch them do all the work while we got to sit back and just enjoy.
That is very interesting. I would like to learn more about those new methods. Probably another interview to line up. But we are very interested in learning more about that, and we congratulate you for the achievements. Really.
Thank you.
Thank you.
Yeah, in terms of the dentistry, I think that was probably the highlight of the trip was making these people, giving them back their smiles essentially, and working under the guidance and expertise of Dr. Barzilay, Dr. Schwarzside, also Dr. Chalamet as well. So we were very lucky and privileged to have that experience and opportunity.
The number of dentures that we made per day would typically graduate 3 or 4 dental students at UFT, right, Court?
Exactly.
For me, this was definitely the most exciting aspect of the trip. Of course, getting to help people, getting to know people there was amazing. But in terms of the dental work itself, to me, this was the most amazing accomplishment that we had this year, for sure.
And it was actually, we got to test out our anatomy because at the end of the trip, we only had a certain amount of denture teeth. So we had to start converting molars into incisors. And they still look beautiful. So
I can see the lady's very happy with her smile.
That was really special. Ella actually fabricated these complete upper dentures with the help of Dr. Barzilay. And as you can see in that picture, showing her smile back for the first time is pretty sure she was cheering up. She walked outside and everyone was cheering for her, clapping and celebrating that she had it back.
It really was quite remarkable to see the changes that these teeth, that these dentures made for these patients. It was really remarkable. It was nothing that they expected, but when they heard that we were doing this kind of thing, the lineups were really tremendous, and the hardest part was deciding who we could treat and who we couldn't treat. That was really the toughest part. So in fact, on this year's trip, which is coming up, we've got a much larger team. We've got more students, we've got more prosthodontists, we've got all kinds of people, so we don't want to turn people away.
These are just examples of people who came with us, either missing all of their teeth or missing anterior teeth. So our main focus was to leave a life-changing, to have a life-changing impact. Let's say help the ladies find a job, help them, be more presentable for whatever they wanted to be presentable for. So our main focus was completely dentureless patients and also patients who were missing anterior teeth. So these are just 2 happy examples.
I can see the smiles in their eyes, not only on their mouths.
So part of our trip was also to visit an orphanage, to bring them supplies and bring them gifts. It usually is one of the things that we do when we go on this trip. So you can see one of the people at the orphanage who was, one of these kids was really into modeling, and Ella took to her, and it was really quite an experience visiting this facility.
You want to talk about our contest? So it's days are busy, and you get to see people who are less fortunate than you are, and not only the work itself, but just seeing how a simple plastic bag makes the children happy does take a toll on you. It definitely does take a toll on you. So just to unwind, at the end of the day, we had drawing competitions. And I think Dr. Barzilay used to win quite unfairly because you're not the best one.
It's just a matter of taste. That's all.
Yes, this is art, so everybody sees it differently.
But it was a lot of fun. It was really, as Courtney said, it was obviously Dr. Barzilay and Dr. Schwarzside are our mentors. It was such an honor to get to learn from them. More than dentistry, definitely learning from them more than dentistry, much more than dentistry. This was just a way for us to laugh at the end of the day and to just to unwind a little bit. I think just being part of such an amazing team made the whole trip such a success. And for it to, well, obviously it does take a toll on you, but for us not to let it get to a point where we would really not be able to go on anymore. So we celebrated birthdays. We really had a lot of fun together as well. It was just the spirit of the team, which was so joyful. They were all so happy to be there, which really helped with everything, definitely an amazing experience. I found it to be one of the most rewarding experiences I've ever had. It definitely stretches you, challenges you, tests you. You show yourself that there are things that you never thought you would be able to do, and you end up doing them with the help of the team, obviously. Another element was that we would work in a very efficient process. So as I was explaining to the dental students as well, our main focus was extractions and prosthodontic work. And typically how this would work, because there were few of us and there are a lot of patients who need care, let's say I would just give local to a patient for an extraction. As the local is taking effect, I would go into the next room. I would take an impression. I would give the impression to Courtney to pour. Courtney would get started with the prosto care. I would come back and extract the tooth, and I would go back, help Courtney finish up that denture, as Courtney is now doing an extraction in the next room. So it would be very, very efficient how the team would work together. Because we were part of such an amazing team, I definitely can say we learned a lot of hands-on skills. We did get an opportunity. There were times that you would treat a patient on your own, and there were times that you would be part of a bigger team. So it basically builds your ability to work alone and also as part of a team. And to me, the possibility of, to all of us, possibility of single-day fabricated removable prosthesis was just an amazing, amazing learning opportunity, opportunity to give back. It was definitely our biggest achievement this time. And to anyone who can contribute, who can help, who can join, this experience is highly, highly recommended. It's a life-changing experience.
This picture actually of that little one, it was actually really nice seeing the way that the mothers would carry around their young ones on their backs, and their sons and daughters helping out as well. But yeah, I can't say enough about how life-changing of an experience this is, and how I would strongly encourage anybody to do it. Every year, the more the merrier, I would say, in terms of getting things done and giving more people back their smiles and changing their lives and leaving such an impact. It's just such a wonderful experience, and I can't say that enough. It's something that I can't wait to come back and do again, and encourage all my friends and family members.
So really what you're looking at here is the whole team, the medical and the dental team. And it was quite the group. This year's group is even larger. But the support of the University of Toronto was outstanding. And we are so happy that we relation now between the University of Toronto and Bridge to Health. It's just an amazing adventure, an amazing way to teach, and just a wonderful way to give back. It really is.
Thank you for that great presentation. It's really an important activity that we need to highlight. So now I want to delve a little bit into some of the details. And can you tell us a little bit about what is the Ugandan Bridge to Health program?
Well, Bridge to Health is a group of medical personnel and dental personnel. This is our 5th year going this coming February. And the idea behind this group was to provide not only care to populations that would not otherwise see this kind of care, but would also be to teach local providers how to provide services more efficiently, more quickly, and in a more cost-effective manner. So it's not just about us going in and providing services. We want to leave a lasting effect so those services can be maintained. So Bridge to Health started off as a small group, and it has grown now to this year's team being, I believe, over 35 people.
Quite the number. So capacity building was one of your goals. Are there any other goals of the trip, of the project?
So basically, obviously, they want to improve, as right now where they're mostly operating is rural, underserviced areas in Uganda. And their mission basically is, as Dr. Barzilay mentioned, provide sustainable healthcare. They also want to improve the delivery of healthcare within the communities. And again, as we already touched upon, to educate the local officers, local dental officers, local medical healthcare providers right there in the rural communities. That's definitely another objective. I think another part of another objective of theirs is to get more students involved into such projects and volunteer work. And this is why last year was basically the first time that 2 U of T dental students got to go. This year, 2 more from the 4th year are going. So this is something new which they're emphasizing on right now. I personally think I'm definitely blessed and honored to be part of this amazing, amazing group of people.
Excellent. Have you encountered any challenges, any issues that you could share?
I wouldn't say, there's always something that for example, when we were doing fillings on individuals, the hand pieces weren't working that great at the beginning. So in conjunction with working with the local dental officers, we had gone to one of his private offices and he had helped us improve that. I can't explain the technical aspects of it, maybe Dr. Barzilay can, and then that was more efficient. We brought that unit to the next underserved community in the rural areas, and it just made it even more efficient than those small things like that, where we all put our heads together and made it work and be more efficient.
Makes you think where you guys come from and where you go. You just open a drawer or grab anything that is right there, but for them it's a completely different context, completely different environment. What are the lessons learned for the next group of people that are going, or professionals that are going?
I think the most important lesson that I learned was I'm not going to be a solo practitioner just working on my own. I definitely felt the value of being part of an efficient, collaborative team with every cell of my body. There were things that I couldn't do, and the person on my right-hand side could do it. There were things that they couldn't do, and I could do. So it really gave me a sense of security, safeness, efficiency. The fact that, I was there to provide care was only possible because I was part of such a big team. And the dental officers were definitely a big part of this team. As a response to your previous question regarding the challenges, we obviously, as can be imagined, we did have the language barrier. So, so we didn't speak the same language as the patients did. And our key to overcoming this barrier were the local dental officers, who were also helping us as translators and interpreters. So this teamwork together was basically the most valuable lesson that I learned, was to rely on people, to give to people, and to receive, to be able to receive and to give back. And we learned a lot from the patients that we treated as well. So just to be able to give them what they needed, and we learned a lot from them too. Most importantly, to, as you mentioned, to appreciate what we have here, to be thankful for what we have, and to know that as healthcare providers, we do have responsibilities to give back to societies who are not equipped with basically qualified personnel.
One more emphasis on the dental team rather than the solo practitioner.
Oh, for sure.
It's a teamwork more than anything else. Can other dentists help in any way, and how do they go about doing that?
Well, the program is really open to anyone, but our main goal obviously is to first populate the program with the students that we want to take with us. It's very important to us. We do have general practicing dentists also coming with us, and they can apply for a position on the team, and the application process is an ongoing process. It is hard on people. It's not an easy process to go through. But we have people of all ages and all skill levels coming on these processes. This year, we have several new dentists coming with us, and we expect that'll happen on a fairly regular basis. So it is possible to apply to come on the trips, and it's easy to access Bridge to Health on the internet by going to the website. And it is an open program. So we invite people, we encourage people to get involved. We also encourage people with fundraising and donations. It's not an inexpensive program to do.
I will have the link to your website, which is bridge2health.ca, I believe. I will have the link to that, and I will have all the appropriate links for anybody who's interested to learn more about the program or to participate in the program. We'd like to spread the word as much as we can. So at the end of this interview, would you like to add anything else?
I would like to add something, actually. I just want to tell people that when you go on these trips, you feel as though you're going to be providing these services for individuals and making such an impact on their lives, but you really don't realize until you come back home and reflect on the experience how much of an impact it has on your own. And it really changes you as an individual, and like Ella has mentioned, and it makes you more grateful, it increases your cultural competence. There's so many good aspects. You gain so many more friendships and mentors in the process. So it's such a wonderful experience, and I really encourage anybody to apply.
And we are definitely proud of you guys. You leave everything behind and you go and do these missions and these trips, and we appreciate that very much, and we're happy to have featured you and spoken about this. I really would like you to come back once you come back again after the next trip and tell us all about it. We will always be happy to have you.
Thank you very much.
Thank you so much. Thank you for having us here. Thank you.
Bye-bye.
Thank you.